Thank you for watching. This is YouTube Medical University. Today we discuss the illness of beloved singer Aki Yashiro. I will explain connective tissue disease from a doctor's perspective in an easy to understand way. Even if you hear the term connective tissue disease, it's hard to picture what kind of illness it is. In short, connective tissue disease is a condition where the immune system, which normally protects us from germs, mistakenly attacks our own body. In fact, there is no established treatment for connective tissue disease, and once it develops, it can sometimes be life-threatening. Even Michael Jackson and Akiko Wada have announced that they developed a connective tissue disease. However, there are many connective tissue diseases that can improve if they are detected early and treated. If they are overlooked and not diagnosed for a long time, for example, with connective tissue diseases such as rheumatoid arthritis, the joints in the hands can become deformed, and things you used to be able to do. It becomes difficult to cook, or you may no longer be able to do hobbies like sewing. Those kinds of things can happen. So this time, in this first session, I'll briefly explain what connective tissue diseases are, and in the second session, I'll introduce 3 warning signs of connective tissue diseases featuring 4 characteristic symptoms. Then, in the third session, if you notice these changes in your skin, please go to the hospital immediately. I'll introduce 4 such characteristics. At YouTube Medical University, we offer simple videos from a doctor's perspective to help you get healthier, so subscribing to our channel would support us. Here's an easy explanation of connective tissue diseases. Normally, our body's defenses protect us from germs, but in collagen diseases, this process is disrupted. These are diseases where the immune system, which is supposed to protect the body, mistakenly attacks your own body. The general term for these kinds of diseases is autoimmune diseases. In other words, these are illnesses caused by your own immune system. For example, when the immune system attacks the thyroid gland, there are diseases like Graves' disease and Hashimoto's disease, and also conditions like IgA nephropathy, where the immune system attacks the kidneys. These are all examples of autoimmune diseases. These are diseases where the immune system attacks specific organs in the body, such as the thyroid gland or the kidneys. In contrast, connective tissue diseases are conditions where the immune system attacks the entire body without exception. These are called systemic autoimmune diseases. The character for ko in Kogenbyo, collagen disease, refers to nikawa, which means glue. The glue in the human body refers to the substance that connects cells to each other. In other words, there is glue in blood vessels, plenty of glue in the joints, and of course a lot of glue in the skin as well. That's why collagen diseases are troublesome illnesses that can cause symptoms throughout the entire body. There are very few established treatments, and the main approach is to use medications like steroids that suppress the immune system to control the cells that mistakenly attack the body. However, since these drugs suppress the immune system that protects the body from germs, it becomes easier to get infections, and due to steroids, side effects like osteoporosis or eye problems can occur, making treatment for this disease often very challenging. The nationally renowned singer Aki Yashiro had this collagen disease manifest strongly in her lungs. Because of that, her lungs became stiff, and the tissue connecting the lung cells hardened, making it difficult for her lungs to expand. It became difficult for her to exchange oxygen and carbon dioxide, and as a result, she ultimately lost her life. So, what should we be careful about in order to notice this collagen disease? As I mentioned earlier, collagen disease shows signs throughout the whole body. If you remember the signs I'm about to introduce, you might be able to catch the initial symptoms of collagen disease in yourself or those around you. There are many symptoms that are easy to overlook because they aren't painful, so please listen until the end. And when you start to worry about collagen disease, the test that is usually done at that time is a blood test. By measuring the antibodies that mistakenly attack our own bodies, we can get closer to a diagnosis. So first, suspect it based on physical signs, and if that's the case, go to the hospital and get a blood test. That's the general process. So, as I've said many times, it's very important to remember the symptoms that commonly appear with collagen diseases. Now, let's review the first lesson. Collagen diseases occur when the immune system, which usually protects the body from germs, makes a mistake. It attacks your own body. In other words, the tissues that connect your body's cells together. It's a disease where the glue-like parts that connect the cells are attacked. There is no established cure, so we use medicines like steroids that suppress the immune system. That's what I explained. Next, in lesson 2, I'll discuss 3 warning signs of connective tissue disease. By knowing these symptoms, you can detect connective tissue disease early, start treatment, reduce complications caused by the disease, and even lower the risk of death. So please listen until the end. 3 warning signs of connective tissue disease. The first one is joint swelling. Please take a look at this image. Can you see that the joint is red and swollen? Since it's a bit reddish, many people might not pay much attention to it. Actually, this photo is of someone with rheumatoid arthritis. Rheumatoid arthritis is a disease where joints throughout the body become swollen and painful. One of the most characteristic symptoms is joint stiffness that lasts for a long time in the morning. It's common to have joint stiffness for about 10 minutes when you wake up in the morning, but if it lasts for more than 30 minutes, even after an hour, your joints still feel stiff and hard to move. They may feel swollen, painful, and warm. Those symptoms could be a sign of joint inflammation caused by rheumatoid arthritis. And actually, many connective tissue diseases often involve this kind of joint pain. If you leave this joint inflammation untreated, the inflammation will gradually destroy the joints, the tissue covering the joints. Because inflammation occurs in the membrane called the synovium becomes stiff as a result. Eventually, your fingers may become deformed like this, even if you just feel a little stiffness and think it's fine to leave it alone since it doesn't interfere with anything. It can increase the risk of deformity. For these reasons, if you have any doubts, make sure not to leave it untreated and consult your regular doctor or a rheumatologist or connective tissue disease specialist. I recommend that you visit a hospital. The second of the 3 warning signs of connective tissue disease is redness of the skin. For example, please take a look at this image. Both cheeks on the face are red, right? Because the redness looks like a butterfly. It's called a butterfly rash. And next, please look at this image. There are purple spots on both legs, right? This is called purpura. And next, this one. The area around the eyelids is kind of red. This is called a heliotrope rash. The name sounds complicated, so there's no need to remember it at all. But one thing I want you to remember is that connective tissue diseases often cause some kind of changes like this on the face or on the skin all over the body. I'll talk about the details of each photo later. I'll go over the details of each photo, but what I want to tell you here is not to overlook changes in the skin. Our skin is made up of multiple layers, and within those layers is collagen. In other words, the glue that becomes the target of attack in connective tissue diseases. Since there is a glue-like part, symptoms tend to appear easily on the skin. In addition, as you can see in this photo, the joints of the hands look kind of rough and red and they appear thickened. Changes like these can actually be characteristic of connective tissue diseases to those who know what to look for. What I want to tell you from a doctor's perspective is that if you notice any changes in your skin like this, please take a photo if possible. And when you visit the doctor, if you ask, "I had these kinds of skin changes, what could this be?" Even if the skin changes are gone by the time you see us, being able to look at a photo is very helpful for diagnosis. So I recommend checking your entire skin, for example when you take a bath. This habit may increase the chances of detecting connective tissue disease early. Here is the 3rd warning sign of connective tissue disease. Fever and fatigue are the symptoms. Symptoms like having a fever or feeling tired can happen with many illnesses, right? Actually, these are also very characteristic of connective tissue disease. When you catch a cold, don't you sometimes get a fever, feel tired, or have stiffness and pain in your joints? These symptoms are your body's immune response trying hard to get rid of the virus that has entered your body. As I mentioned earlier, connective tissue diseases are conditions where your immune system mistakenly attacks your own body, so you experience symptoms similar to when a virus invades. Because your immune system is activated, you may develop a fever or feel tired. It's possible to have pain in your joints and muscles all over your body. It's easier to remember if you also consider the reasons this way. Since your body is constantly inflamed and your immune system is working actively, your body gets more and more exhausted and you get tired easily. In some cases, some people may lose weight, and there are 2 major differences from a common cold. The first is, of course, that it's not a cold. There are few symptoms like a sore throat, coughing, or a runny nose. However, as I mentioned earlier, If a connective tissue disease affects the lungs, you may develop a dry, hacking cough, so you need to be careful about that. So, how can you tell the difference in such cases? The second difference is the duration of the symptoms. Normally, if you catch a cold, you'll be almost completely better in about 2 or 3 weeks. However, in the case of connective tissue diseases, since they are caused by immune system abnormalities, a low-grade fever may persist even after 2 or 3 weeks. Please remember this difference. Now, let's review the second section. Here are 3 warning signs of connective tissue diseases. First, swelling and stiffness in all the joints throughout the body. And second, various changes appearing on the skin. And third, symptoms like fever and muscle pain, similar to when you catch a cold. I recommend that if you notice any changes in your body, you take photos or otherwise record them. Finally, I will introduce 4 symptoms that if you experience them, you should go to the hospital immediately. Here are 4 symptoms for which you should consider seeing a doctor. The first is purpura. Please take a look at this image. You can see purple spots on the legs, right? If you think these spots are just pimples or maybe some kind of allergy and leave them untreated, it could be dangerous. So, how does this purpura occur? Actually, it indicates inflammation of blood vessels throughout the body. In other words, because it's inflammation affecting the whole body, it can be a sign of connective tissue diseases, such as rheumatoid arthritis, Sjögren's syndrome, systemic lupus erythematosus. When you develop these kinds of diseases, inflammation also occurs in the blood vessels, causing small ruptures in the walls of blood vessels throughout the body, which leads to bleeding and these kinds of skin changes. Blood vessels run throughout the entire body. When vasculitis occurs, it often causes damage to organs with a lot of blood flow, such as the liver and kidneys. Please pay close attention to this symptom called purpura. Of course, it's not only a characteristic of connective tissue diseases, but it can also occur when you become more prone to bleeding. This purpura can appear, for example, when we get injured and start bleeding, our blood naturally clots and stops the bleeding, right? This is thanks to platelets, which are blood cells that act like glue to help stop bleeding. In diseases where the platelet count suddenly drops, you may see purpura like this on your legs, but in any case, it's a sign that you should go to the hospital. Please be sure to consider seeing a doctor. The second of 4 signs you should watch for is Raynaud's phenomenon. Seeing is believing. Please take a look at this image. You can see that one of the fingers is completely white. This is called Raynaud's phenomenon. When you go somewhere cold, your skin might get a little pale, right? That's because of the cold. To protect your body temperature, the blood vessels in your hands constrict, and by gathering blood toward the center of your body, it prevents heat from escaping. This can happen to anyone, but sometimes, like this, only certain fingers turn completely white and don't return to normal easily. This is called Raynaud's phenomenon. For some people, after their fingers turn completely white, they may become swollen or change color from purple to almost black. The connective tissue disease characterized by this Raynaud's phenomenon is called scleroderma. When it's cold or when you're under stress, the blood vessels in our skin suddenly constrict, which means they become narrow very quickly. This is believed to cause poor blood circulation, making the skin turn completely white. If scleroderma progresses further, blood flow can stop entirely, leading to tissue destruction. This can result in ulcers, where the skin at the fingertips becomes deeply eroded. To prevent this kind of progression, please make sure to consider seeing a doctor if you experience Raynaud's phenomenon. Here is the third sign you should watch out for: heliotrope rash and Gottron's sign. The names might be hard to understand, so please take a look at this image. The redness around the eyes is called a heliotrope rash, and when the joints of the hands look red and feel rough, this kind of change is called Gottron's sign. You might think it's just rough hands or an allergy around your eyes, but if you leave it untreated like this, it can actually lead to very serious complications. These kinds of changes can cause a disease called dermatomyositis is characteristic of connective tissue diseases. In fact, this is the illness that Ms. Aki Yashiro, whom I mentioned at the beginning, suffered from. The disease is called dermatomyositis, and with this dermatomyositis, as well as with other connective tissue diseases, there are some serious complications that can occur. That is a disease called interstitial pneumonia. The lungs are sponge-like organs made up of many small sacs called alveoli. A sponge is soft and can shrink or expand, but when you develop a connective tissue disease, your lungs become stiff, making it harder for air to get in. and the exchange of oxygen and carbon dioxide doesn't work well, so no matter how much you breathe in, you still feel short of breath. Such frightening changes can occur. The characteristics of interstitial pneumonia include having a dry cough lately, and even after just a little walking, you get out of breath and need to rest. Such changes could be a sign of interstitial pneumonia. The frightening thing about connective tissue diseases is that sometimes these life-threatening complications can occur. Be sure not to overlook the changes in your eyes or hands that I mentioned earlier. Here is the fourth sign that you should see a doctor: dry mouth or dry eyes. Do you ever experience dryness in your eyes or mouth? If it's just a little dryness, there's usually nothing to worry about. However, if your eyes are so dry that you need eye drops all the time, or if your eyes hurt and you can't even watch TV because of the dryness, that's a concern. Or if your mouth is so dry that when you eat dry bread or seaweed, it sticks to your mouth and you can't swallow it at all. If your mouth is extremely dry and the surface of your tongue has changed, please. If you have symptoms like these in your eyes or mouth, there is a possibility of a connective tissue disease. If these symptoms are interfering with your daily life, causing inconvenience, or if you are enduring any discomfort, at that level, please consider visiting a hospital. These symptoms of dryness in the eyes or mouth, a disease that is characteristic of connective tissue diseases, is called Sjogren's syndrome. You don't need to remember the name, but if you develop this Sjogren's syndrome, the salivary glands that produce saliva and the lacrimal glands that produce tears are affected, which can lead to dry eyes and a dry mouth. Your eyes hurt too much to watch TV, and dryness prevents you from wearing contacts or going without eye drops. Your mouth is so dry you can't eat bread or seaweed. Talking for a long time can dry out your mouth, make it feel tight, and make speaking hard. These symptoms could indicate Sjogren's syndrome. Please consider seeing a doctor. With Sjogren's syndrome, if it's just dryness, it might not be so bad, but as I mentioned earlier, it can cause inflammation of blood vessels throughout the body or even interstitial pneumonia, so please be careful. Now, let's review Lesson 3. We talked about 4 symptoms for which you should see a doctor, such as purpura, which are purple spots that appear on the skin. Raynaud's phenomenon, where your fingers turn completely white and don't return to normal easily. In addition, the skin can develop ulcers, meaning it starts to break down. I introduced those features of scleroderma, and also the characteristics of dermatomyositis, such as Gottron's sign and heliotrope rash. And finally, I will introduce the features of Sjogren's syndrome, where the eyes and mouth become dry. There was a lot of information, so it might be hard to remember everything in one go. I hope you'll review it by listening to it several times or taking notes. How was it? Please let us know in the comments if any of these symptoms apply to you, and share your experiences as well. We're eager to hear your thoughts on the video. Whether you give it a thumbs up or down, your feedback helps us improve the channel. Starting tomorrow, I'll keep sharing clear, trustworthy videos from a doctor's perspective to help you get healthier. If you don't mind, please subscribe to the channel so you won't miss any new videos. I'd really appreciate it. Well then, see you in the next video. As a general practitioner, I've learned from my patients how to stay youthful in your 70s and beyond. The book became a bestseller in 4 categories on Amazon and ranked #1 in the gift rankings. I've compiled into one book the important ways of living and health tips that I've learned from my patients while working as a doctor. It's a book that will make you think, I want to live a healthy life like this too. It's been very well received and is now on sale, so please check it out.